Tonight, in South Carolina, the state's health department, DHEC, says COVID test results are delayed all over the state. Since the Omicron surge in late December, results that should take 2 to 3 days, in some cases, coming in a week or later. WCNC Charlotte's Indira Esquiva joins us live in York County. Indira, what's the holdup?
Fred, with the Omicron surge, labs are reporting being overwhelmed with the sheer number of people getting tested. And that's affecting businesses like the ones all around me, because in most cases, people can't go back to school or work until they get those test results.
You almost need a test for anything you do publicly, whether it's to be allowed in sports, venues, travel.
Eileen Bright says it took 6 days to get her COVID test results back instead of the 2 or 3 days promised. Meanwhile, Molly McGee and her daughter are still waiting for their results.
I've been looking at my email like you would be tracking a package.
South Carolina's health department, DHEC, is reporting significant delays in testing across the state. Most of the tests in South Carolina are processed by independent non-DHEC labs, which have experienced an overwhelming increase in testing volume since the Omicron variant.
On December 17th, overnight, we saw a 400% increase in the amount of tests that came in. And over the subsequent weeks, we saw a 733% increase. So that's just since mid-December.
DHEC says the lab experiencing most significant delays is Greenville, South Carolina-based Premier Medical. The company says since December, it has hired 250 new workers and expects normal test times to resume within 2 weeks.
We realize that this negatively impacts people's lives. And, when they can't get their test results in that timely manner.
DHEC didn't tell us just how many tests were affected across the state, but we have learned that DHEC is ordering 50,000 rapid testing kits to be used across the state, though those are not yet available. Live in York County, Indira Esquiva, WCNC Charlotte.
Indira, thank you. And we did ask DHEC if the delays are affecting the public COVID-19 data in South Carolina. DHEC said data is still reliable and reflects the latest trends.